So my name's Alex Scott. I'm the branch secretary of the Together Union. I'd like to first of all acknowledge the traditional owners of the land that we're meeting on across the state today and pay my respects to their elders past, present and emerging. Today we will be trying to work through particularly issues in relation to COVID mandation within the public service, and that is quite a fast moving conversation. So we will try and keep the session to half an hour as we do with all of these, but depending on what happens over the next week or so, we may have to do some follow-up Zooms depending on what decisions are made or not. So in terms of the session, the main issue that's coming up in the public sector and the public service at the moment clearly is in relation to the mandation of vaccinations within the Queensland Public Service. In terms of that process, what we know in terms of the broader kind of roadmap for Queensland is that we have at this stage already had some partial announcements in relation to opening of the borders, but over the next month we are likely to see on all projections at this point in time the full opening of the borders on the 17th of December or slightly earlier than that, which is going to have a big impact on relation to what we know is going to happen in terms of the COVID response in Queensland. And what that particularly looks like is the fact that while we've been very successful over the last 2 years in relation to elimination of COVID in Queensland, we haven't seen that same level of success in other states or other parts of the country. So while we are getting close to significant percentages of the population becoming vaccinated, once those borders open, we will see an increase in the level of COVID within the Queensland community. That is impossible to avoid in the current projections. And so we will go from double donut days of 0 cases and 0 in the population to having a largely vaccinated population. But with that largely vaccinated population, COVID will be less of a risk to those individuals, but we will see COVID spreading throughout the community, particularly as we see overseas travellers coming to Australia, or if we see travellers from New South Wales or Victoria. So in terms of that, while we've seen significant vaccination mandates in New South Wales and Victoria in response to their circumstances, we're at a much earlier stage of that conversation in relation to where mandates may or may not occur within the Queensland public sector and within Queensland. In terms of mandation of vaccinations, there are kind of 3 key areas where mandations could occur in Queensland. One of those is through health directives, and they're the ones primarily that's been used by the public sector in New South Wales and Victoria. Further, there is the ability for employers to individually mandate. So the health directives are by the Chief Health Officer. Then there is the ability for individual employers to provide mandates for the people they employ, both in the public sector and the private sector. And there is the potential for some sort of legislative mandate, although that looks like it's clearly off the table in the Australian context at the moment. Where we've been to in Queensland up till recently and since the last Zoom was that Queensland Health and the Queensland Police Service have had mandates applied to their workforce. That has come through in terms of that process. But it's important to understand that while Queensland Health has mandated that all its employees must be vaccinated for COVID-19, that has been done by the Director General as the employer, not by the Chief Health Officer as issuing a CHO directive. Secondly, then that was followed by the Queensland Police Service, where the Police Commissioner similarly issued a public service employer-related directive rather than a CHO-related directive. And that was where basically the conversation was at in terms of the public sector, in terms of that process. But what we've seen in the last 8 days or 9 days has been the CHO making some decisions, making some announcements in relation to the potential for mandation by the CHO, the Chief Health Officer, as opposed to mandate by particular employers, which is consistent with what's happened in Sydney and Melbourne and New South Wales and Victoria, where the Chief Health Officers there have provided much more significant mandates across the industry. So you'll see AFL players in Victoria are mandated to have to be vaccinated because of their CHO direction rather than by their employer in terms of the football industry. In the last week or so, we have seen decisions by the Queensland show in relation to Queensland directives in relation to mandating particular employers or particular industries beyond in a CHO health directive rather than a employer-specific directive. So the first announcement about that last week, was in relation to kind of pubs and clubs and a variety of employers, where the CHO made an announcement which has yet to be implemented through a formal directive, hasn't been as of this morning, which was that both patrons and also staff in a range of industries were going to be required to be fully mandated. And in terms of that, there was also statements in relation to the public sector that the visitors to prisons would be mandated, and also the visitors to Queensland government-owned art galleries and museums would be mandated. The CHO announcement last week didn't include prison staff; it just referred to prison visitors, but it did refer in the private sector in terms of the entertainment industry, hotels and coffee shops, etc., both as patrons and staff. So there was, and there still is not complete clarity about what that CHO directive will mean for public sector employers in relation to how that will roll out. And we'll see that once we actually move from the press announcements of last week and a kind of grid of decision to the actual formal paperwork of the CHO directive. The second CHO directive that was announced last week and implemented last week in a formal decision was that in relation to health workplaces and health work sites, both public and private have now been mandated by the CHO. So earlier in the year, a couple of months ago, the Director General of Health started a process of mandating for health workers, including Queensland Health. The CHO has now gone further than that and mandated for all hospital workers and all health work sites, public and private, are now going to be mandated through a second CHO directive, health directive, in addition to the employer directive that you would have seen covered in the media and in the Courier Mail and other things about nurses and doctors having to be mandated. So that we have seen a step in the last week or so in response to the opening of the borders that the CHO, the acting CHO at the moment, is going further than previously in terms of mandating and using CHO directives. So in terms of that health directive overlaps and complements identically the public service Queensland Health Directive, but goes to non-employees as well, such as contractors and consultants and whatever. And it also reaches into the public sector because it covers disability services. So all disability work is now covered by that CHO directive. And so our members in the ASNRS, the disability services within the government department, are caught by that new directive, by the CHO directive, independently of anything their employer has decided to do or not do in that regard. So we are now moving into a new area where there is both the potential in Queensland, as there is now has been in other states, between a combination of employer directives and CHO directives in relation to mandates. And what we know is that previously there's been a kind of what the roadmap looks like moving forward is that we know that there is some key dates coming up. And one of those is particularly around school term, which in the largest employer in the public sector outside of health is in schools and education Queensland. Clearly the ability to have conversations around what's happening in terms of next year is severely limited after schools close and we have most of our members kind of no longer at the workplace in terms of schools. So there is some key dates around the 10th of December, and then there is likely also that once we get to 80% full vaccination, that we will have further opening of borders, which will be a potential trigger and has been a trigger for some of the announcements last week. That decision in terms of the 17th of December, roughly at the moment, may come back a bit earlier if the vaccinations rate picks up, and so therefore people are able to come in from overseas, might also drive the decision-making around the CHO decision-making and or employer decision-making about the likelihood that there will be significant increases in COVID in the community, and then there's likely to be also a further round of kind of preparations for that process, looking at what happens in terms of particularly schools next year, in terms of starting of term one next year. So while we've had quite specific and urgent timeframes in terms of COVID response over the last 18 months, we're now getting into a space where we know these decisions are likely to be key trigger points, and what that might look like in terms of what that looks like for the public sector. So The first round has been that kind of decisions made last week in terms of the extension to the private sector in terms of hospitality, and potentially that might or might not overlap in terms of art gallery, museum, and our correctional members. And then we're likely to then look at some key decisions being made in relation to preparation for the borders opening, because when the borders open, we're likely to see then significant, well, going from zero to having some community transmission. And what that looks like in a community sense is going to be around the 17th of December. So the show announcements last week in relation to the kind of entertainment industry was looking at kind of the first jab being required around the 17th of December, in linking that decision to the opening of the borders. And then next year, we're going to be looking at the potential for another key date being January next year with the start of term one, next year. And also since then, we've also seen in the media, the government has said both that they are looking at this, that while we haven't kind of been engaged directly with the ministers around this, there was certainly some coverage earlier this week or late last week, sorry, I think it was the Friday last week, indicating that there is conversations going on about a whole of government approach to this. And I think what we're looking at in terms of together is thinking through what might happen in terms of CHO directions, which would be legal directions where there wouldn't be a process, as opposed to employer directions, where the employer clearly in terms of the capacity to try and mandate the ability to have this. So an example of that would be in the private sector. There are CHO directives in New South Wales and Victoria for retail workers. So if you work at Coles or Woolies in New South Wales and Victoria, there is a CHO directive that will require you to be mandated to be vaccinated. In Queensland, the employer, Coles and Woolies, have announced they are going to implement a similar directive for Queensland workers in their supermarkets, but that will be on a different head of power. That'll be the individual employer making a decision rather than a legally binding CHO decision where the employer has no choice but to implement it. So in terms of that process, that is really where we're looking at. In terms of that exercise, a number of these, the law is reasonably well established in terms of legislation, but the court system is dealing with a number of appeals, both in terms of CHO directions in New South Wales, less so in Queensland, but there's been a number of court cases taken in relation to the employer decision in terms of police and health, and though the industrial court has made some decisions around that, and there is also some Supreme Court action that is yet to be heard in relation to the police and health matters. That'll be heard prior to Christmas, but not much before it. And then there is a number of decision cases that are flowing through the private sector fair work jurisdiction in relation to the ability of employers to mandate that process. So particularly there'll be a significant test case coming up just before Christmas in relation to BHP, where the full bench of the Fair Work Commission is going to consider a number of matters, and the structure of that bench is likely to then mean that will provide significant precedent value in relation to what employers can or can't do in terms of that process. So in terms of that, what we're trying to work that through at the moment. We've got the kind of health directives in place, and for private sector for workers. We've got that now in relation to, in Queensland Health, we've got the employer directive, but now we've got that complemented by a CHO directive, and we're waiting to see what the final wording of the CHO directives in relation to corrections and the arts is from last week, but certainly there are parts of the public sector in terms of disability services that are likely to be covered by that. In terms of that process, though, there is significant variation between the processes required under whether it's a CHO direction or whether it's an employer direction in relation to COVID. And in terms of that process, while the CHO will make their decisions in terms of this exercise, and that is one thing, but where the employer chooses to make decisions, there is requirements for consultation before those decisions are made. And what we're looking at is a union response to what we think is going to happen over the next kind of 4 to 6 weeks in terms of that process. And one of those clearly is going to be in terms of the about how we would then be wanting to think through what we as a workforce deal with this issue. We think that in terms of the processes, that no matter what happens in terms of the CHO processes, I think we're likely to be seeing employers engaging with us in the public sector to consider whether or not we should be, whether or not they should be fully requiring a mandate for vaccination. So as part of that process, what we would, as previously briefed to members in during this, that we will be then on an agency by agency basis engaging with members and having members determine your view in relation to that process. So today's poll is just to get a feel for the broader view across the service about what this looks like. What we will be doing is, if your department or agency comes to us and says they want to have this conversation in a employer mandate rather than the CHO mandate space, that we would then be looking at getting members to direct your position moving forward as to whether you believe a mandate is appropriate or not. But in a broader sense, what we will be wanting to work through is also how the union and workers collectively should be dealing with this. And the broad claim that we're suggesting as our way forward to this will be, first of all, members making a decision on an agency by agency basis as to whether or not they think the employer should be able to mandate in their workplace. At this point in time, the CHO doesn't have to consult. The employer has to consult post a CHO decision. But if it's not a CHO decision, the employer has to consult prior to that and seeking what that should look like, but also particularly in terms of then the kind of working through both the consultation process and distinguishing between what is a CHO decision versus an employer decision. Secondly, looking at the question of timeliness. Our experience in terms of this with police and health was that we had quite a long lead in time. I am quite nervous about the timeframes for the 17th of December and potentially term one is quite short, and what that would look like in terms of the ability, if the employer does choose to go down this path, to work out what that would look like. And then in terms of that process, thinking through what is an appropriate capacity for workers to be covered by that. I think that particularly with the timeframes that were used within police and health were quite that there was quite a strong lead in time with that. If the government or departments seek to try and rush this, I am nervous that they might try and have that go back to the kind of key timeframes of this, the roadmap. That might mean there is less time available for workers. And then secondly, that's why we want to have that timeliness component. Thirdly, I think there is going to be potential if the CHO does some decisions like in disability services or in health, that there may be capacity for the employer to either have a CHO decision and or an employer decision. The CHO may say X amount is covered, but the employer still has to consider in terms of the safety of their work and the capacity for the employer to continue to function, that the employer may seek to go further than CHO directives. And what that looks like and what the interrelationship with those two activities is, and making sure that we understand and the workers have a say in relation to what those timeframes are, particularly about employer decisions where there's more requirement for consultation than there is with CHO decisions. And finally, that making sure that during any of these processes, that if the employer is seeking to implement these decisions, that there is still going to be a significant component of the workforce who are unable to or are unwilling to get vaccinated. And that has been a process that has been quite detailed in the police service and the health service system. It's not been perfect, and we are still running appeals for individuals in that process. But in terms of the ability to then make sure that there is a timely process, but also having some consistency between the public sector agencies, that one department doesn't have a different approach in terms of exemption considerations, because even if it is a CHO direction rather than a departmental direction, there will still be a requirement for the employer to consider whether people are exempt from that process and what steps are taken to provide meaningful response in relation to those people who are unable to be covered by that process. So in terms of that, we're kind of keen to try and work that through as a process. And we'd be interested to know in terms of while there will be the specific decision you have to make as members on an agency by agency basis as to whether you support the ability for the employer to mandate or not, which will be a kind of an individual departmental choice, working through whether this is independently of whether we oppose what the employer is doing, the ability to put up these sort of issues in terms of a union response to how staff are treated, as opposed to just a union response in terms of how the employer may or may not seek to mandate within the sector. So in terms of that process, we would be wanting to get some feedback about that, and hopefully in terms of this, we'll be able to use this as a broad process and then come back to you on a departmental basis, depending on exactly what decisions are made by government. But certainly I think that will be highly likely to be a space where individual departments are going to be going through it. So in terms of that, the other questions particularly are going to be, I think, around vaccination status and the ability of the employer to seek information on this. Clearly, if they seek to mandate, they are then going to be asking for information in relation to people's status. We are working on the legal side of that, but it's going to be, we're going to have to work with, depending on that legal advice will be subject to what the employer is doing in terms of whether it's a charity direction or an employer direction, but making sure that any data collection that is appropriately managed and that the workers' rights are individually protected through that. We can't provide significant advice at this point in time because the advice will change depending on what the legal activity taken by the employer is, and also whether the courts do or don't uphold the decisions taken by the employer. My expectation is that, given the tenor of those decisions, we're not hopeful that the courts will interfere in this process, and I think the employer is likely to have the decisions based on the Supreme Court in the New South Wales and the recent Industrial Court. I think it's likely that the precedent cases that will occur during December are likely to primarily mandate the employer ability in this space. I think it is primarily going to, we're not putting this in writing because we don't want the employer to use it in their cases, but I think my best advice to people at the moment is that those decisions are likely to come through in relation to the employer having some capacity on this to mandate, and then say that they can't require you to be vaccinated, but they can say if you want to work for them, you must be vaccinated. But we also think that those processes are unlikely to cover the whole of the sector, and that particularly in government departments, while the employer has the ability to be able to require, in some places that has to be based on reasonable, and we think that the ability to mandate in a COVID hospital is going to be different in terms of reasonableness compared to mandating in 1 William Street. So we think at that point in time, one of the challenges we're going to face as we move through the next couple of months, and there is a significant escalation, or COVID comes to Queensland effectively for Christmas or after Christmas, we are going to see some real challenges in relation to whether the government seeks to lock down in the same way it did last year and this year in response to COVID in a vaccinated population. So we think there'll be less lockdowns potentially as part of that process, but that then means we are going to be having a situation where there is going to be people working next to each other, some vaccinated, some unvaccinated, and we think that's going to be potentially quite a divisive situation in workplaces. This is a very deeply felt issue by all workers. People have different views on it, but we are wanting to work through in terms of that process, whether or not there is a role for the union in terms of trying to make sure that this doesn't divide the workforce, that no matter what happens in terms of people working together, that we want to make sure that people are respectful of each other's views, and also that this doesn't become something that is splits the workforce and causes unnecessary tensions in the workforce. If we have an outbreak of COVID, it is going to be challenging in everybody's mental health state, as well as their capacity in relation to health work. So from that perspective, we are keen to work through this and see whether there is broad support for making sure that that if there is people who have different views in relation to COVID, in relation to vaccination, in relation to the broad health response, that is something that people respect each other's views, respect each other's privacy, but doesn't become something where people are targeted through mobbing or whatever, or bullying in the workplace. And we think that given the disconnect in some of the communications up till now by the departments, that there may be a space here where the union can have a role in terms of promoting conversations that doesn't result in negativity within the workplace. So obviously there's broad support that from people today, and we'll be keen to keep on working on that. Sorry, I haven't been sharing the results because of my technology failures. I'm not sure if I need to show them on screen or not. So that's really where we're at with the COVID piece. We think it is going to be a very fast-moving piece over the next couple of weeks. And depending on where we get to between now and the 17th of December, we'll need to do specific agency feedback or departmental, or more broadly, depending on what decisions are made over the next by the CHO or individual employers. In terms of the other issues we did want to touch base on today was in relation to the recruitment selection review. Given our time, we can't cover that in much detail, but we can advise that the Public Service Commission has accepted our recommendation in relation to seeking that to be extended rather than a rushed review. So hopefully we're talking to government about that at the moment, and hopefully that will extend into June next year, which will mean that the review of recruitment selection will overlap with the CCC audit of recruitment selection. It'll be then slightly out of sync with the Public Service Act review, but we'll be able to spend time next year doing more complete reviews in relation to recruitment and selection. And the other piece that has been delayed because of the focus on COVID vaccination and the kind of time agencies are thinking about that at the moment has been the working from home policies. We do, I think, and there's another further meeting in December, but I'm now confident that the conversation about moving from working from home being the exception through individual flexibility arrangements to becoming the new norm, I think we have gone a long way in relation to that process, and I would be hopeful by Christmas we will have good news to report back on having a better system for regulating that process. So in terms of that, we are keen to do those negotiations, but we're also recognising that the urgency of the COVID response is likely to mean that we are not going to get the same level of engagement with the employer than we otherwise would have. So that's gone a couple of minutes past what we want to do in terms of the half hour. We will be wanting to continue these processes, these Zooms, and we're trying to work out when the next one will be in December. But then I think then the next kind of process will be working through how do we continue to better engage with the public service membership in terms of some of the sector-wide issues. And one of the things we've been working on at the moment is also redeveloping a new website to try and improve the way that we communicate with members and to give members more control over their industrial capacity. We've had great feedback from members in terms of promoting the union in conjunction with these Zooms, and we'll continue to ask people who are active to do that. But before we kind of launch a new website, we're also keen to get direct member involvement in that process to see whether the website is consistent with the sort of things you would want from a 21st century union website, both in terms of member engagement, but also access to new information and access to new technologies. So if you are willing to have a conversation or take part in a survey with an organiser in relation to, we can give you early release of the site before it goes live, but then that would be an opportunity for us to get some structural feedback and hopefully some constructive criticism about what we could do better on our site, because I think everybody recognises our current site isn't best practice, but we are seeking to do more in that space. But we'd also want members to design the website as much as the union office within the broad technology. So if people are willing to be part of that process, it'd be really helpful for us, and hopefully we can then continue that process. So that is coming to the half hour spot. We will try and get as much information out to people as possible, as quickly as possible in relation to COVID. I'm sorry we focused so much on it today, but it is the topic at the moment. And I think in terms of what happens over the next, 10 days is going to be critical. And hopefully we will have been able to provide you with some background as to where it might go. We might be completely off base on this, and there might be something completely comes out of a left field in terms of process. But I certainly think since last time I spoke to you, there has been a shift in the CHO processes to becoming more involved in mandating, which I think does change where we were at with place and health to where we may get to. How far that goes in the public service, I think, is still unknown, but is going to be a live question for the next week or so. And I think it is going to have to happen in those timeframes, particularly being driven by Education Queensland and what happens in schools. And then I think there will be two conversations about both what happens with a CHO direction and what happens with our employer-specific direction. And we need to give you as much information as possible, as quickly as possible. But hopefully, but I expect that's going to happen sooner rather than later. And please take the time to get involved. But we'll also continue to try and use this Zoom structure as a best way of articulating what's happened, because I think with these complicated issues, sometimes that's easier than trying to work exactly worded emails where the meaning can be lost in terms of that process. So please stay involved. If you've got feedback, we'll do one of those standard feedback forms we do after each of these, and we'll try and, we have also noticed that we've been getting questions beforehand and we haven't always been answering them. So we are putting some steps in place out of today's Zoom to try and make sure that if you registered a question beforehand, that they're followed up and answered through that process. So thanks very much for your time. Please stay involved. And if you are able to help us with the website, that'll be a great opportunity for us. And thank you for everybody.